Welcome, everyone. I'm Steve Feldman, president of the Human Animal Bond Research Institute, HABRI for short. Welcome to another session of Pet Week on Capitol Hill. Today's session is sponsored by Zoetis. Zoetis is the world's leading animal health company and, very importantly, one of the founding organizations for the Human Animal Bond Research Institute, so committed to the human animal bond and supporting our important research on all the ways that pets are good for people. Today, I am fortunate to be joined by Ester Banque. She is the Executive Vice President and President of U.S. Operations for Zoetis. Esther is an amazing leader in the field. For 30 years, she's been leading business transformations and product launches for companies like Bristol-Myers Squibb and Novartis. Zoetis is so lucky to have her as President of U.S. Operations, and we're so lucky to have her joining us today. We're going to be talking about some new legislation that's just been introduced in Congress, the People and Animals Wellbeing Act, or PAW Act. We're going to get into what that's all about in just a minute. But right now, let me welcome Ester Banque.
Oh, thank you so much, Steve. Actually, that was a very kind introduction, and I'm so excited to be here today and pleased to discuss with you the People and Animals Wellbeing PAW Act here in the Pet Week on Capitol Hill. So delighted to be here and looking forward to the conversation.
Now, I know you're going to probably want to ask me some questions about the legislation, but I have a couple of questions for you to kick us off. As I mentioned before, Zoetis is one of HABRI's founders. And so let's start off maybe just talking about the human-animal bond and the work that Zoetis does.
Yeah, that's right. I mean, Zoetis is one of the original founders of HABRI. And we are committed, very committed and dedicated to advancing the science of the human-animal bond and also to supporting efforts that will help keep pets and people happy and healthy together. I wasn't here, but I learned, because I've been only 1 year at Zoetis and also in animal health, but I learned that there was a very important survey, the HABRI and Zoetis International Human-Animal Bond Survey, that covered 19,000 pet owners across 10 countries. So a very sizable survey. And that showed that 98% of pet owners experience positive health benefits from their pet. That includes increased happiness, reduced loneliness, and decreased stress, and as well as improved cardiovascular health. That was really, when I read that was really impactful. And then I thought about my own reality. At home, we have Yuna. She's our 5-year-old rescue dog, and we love her. And, just being around her, it makes me feel happier. And she only needs to look at me with these big eyes, wag her tail, and always ready to play, no matter how maybe stressed I am or tired, or that she gets me in a better mood, immediately, right? I also have teenager daughters, and maybe the effect sometimes is different, but that's a different discussion. That will be, for another day. But yes, Yuna makes our life very happy at home. And when I saw the results of this survey, definitely I wasn't surprised, actually. There's another piece of information out of that survey that was also very, very significant, that 76% of pet owners globally say that they will pay whatever it takes if their pet needed extensive veterinary care. And 92% of pet owners say that there is no reason they will ever be convinced to give up their pet. So very compelling research that shows that there is no question that pet owners are highly committed to their pets, and the health benefits of pets are very well documented. So for this reason, is very important that we do everything possible to help pet owners take better care of their pets so they can live long and healthy lives.
Thank you for that. I think those statistics really have a a lot of relevance to our discussion today, because if people won't give up their pets and they really need veterinary care, and they're going to spend whatever it takes, we need to help make it more affordable and more accessible so that every pet and every family, remember the pets are family, can get the help that they need. Before we get into that, I do have one other question, because I want to congratulate you on recently becoming chair of the board for the Animal Health Institute. That's quite an honor. And I want to ask you about that. If you could just talk a little bit about the Animal Health Institute and the work that's happening there.
Thank you, Steven. You just say how I feel. I feel honored to be the chair of the Animal Health Institute, which is an organization, our trade association that represents the companies that develop, produce, and commercialize animal medicines here in the U.S. Our industry is a global leader, and our innovative products improve the health of nearly 10 billion companion and food-producing animals in the U.S. I repeat, it's nearly 10 billion. So we are so present in everybody's lives that it is a true responsibility that every company does their best. And we as an organization at the AHI are also supporting that joint effort, because it will result in significant economic and social benefits for Americans in the end.
I think that's so important to really think about animals as so integral to our lives and to our health, and also to think about that economic benefit to and the contributions to our economy. I know that matters to a lot of people everywhere, and also to our audience from Capitol Hill, that they really understand the work that Animal Health Institute and Zoetis and the Human Animal Bond Research Institute that we're all doing together.
Yeah, absolutely, Steve. Now, if I may, we're going to turn the tables, and I'm going to be the one asking the questions, right? Are you ready?
Works for me.
So let's talk about a new bill introduced by Representatives Claudia Tenney and Deborah Ross. The bill is the People and Animals Wellbeing Act, Act that you already alluded at the beginning of our discussion. Let's start with the basics. Can you tell us about the bill and what it seeks to accomplish?
I am happy to do that. So we talked about the importance of veterinary care. This bill would help millions of Americans afford veterinary care just a little bit more easily. And here's what the bill does. Well, first I should ask, probably you and many people have either a health savings account or a flexible spending account. And these are accounts that allow you to put aside a little of your own money, pre-tax, to use for healthcare spending, your prescription copays or your doctor copays and those kinds of things. This bill would allow you to spend up to $1,000 from a health savings account or a flexible spending account, an HSA or an FSA, for your pet, for veterinary care, or for a pet health insurance policy. The bill would place no limit, no $1,000 limit. It would just let you spend whatever you needed for a service animal, because those are specially trained animals to help people with a disability. And why the $1,000 limit? Well, pets are important to our care, but we don't want people to spend all the money on their pet like we know they might. So they need to make sure they save some for those other purposes. And a pet health insurance policy also helps keep costs down. So that's why it is included in this legislation as well. So if people can have a little more flexibility to use their pre-tax dollars from HSAs and FSAs for veterinary care, it's going to make it more affordable for millions of Americans, as I said before. And it's a fiscally responsible bill. It doesn't actually raise the limit of what people can set aside. It just allows people to have more flexibility to spend their own money on their four-legged family members.
Thank you, Steve. Definitely a well-thought-through bill, as you said. And it's an important piece of legislation and incredibly timely. We know that 66% of American households have at least one pet, which is an astonishing fact if you think about that, right? So this bill is going to definitely help a lot of pet owners and a lot of Americans. So for many of them, the rising cost of veterinary care can pose significant challenges. So can you tell us more about the goals of this legislation?
Happy to do that. Well, so first, you mentioned 2/3 of American households have pets. Most people don't know, by the way, that the majority of those households have more than one pet. I think of the households with pets, it's over 60% have more than one pet in the home. So when you think about a vet bill, it might be for 2 pets or 3, and that can be a significant cost for families. And so we want to make sure we reduce that. And why? Because we want to keep people and their pets together. You mentioned the research that you support as part of HABRI. We do so much research on the human health benefits of pets. So it's important to think of pets not just as something nice to have, but they're part of the family and they improve our health. As a matter of fact, we did an economic study which showed just a preliminary number, a $22.7 billion savings to the U.S. healthcare system. I mean, after all, if pet owners are a little bit healthier, you should be able to calculate that they're a little bit lighter, a little bit more savings when it comes to the U.S. healthcare system. So this bill to make veterinary care more affordable is actually very closely linked, not just to pet health, but to human health as well.
Yeah, actually, the work that HABRI is doing in collaboration with companies like Zoetis is very relevant for the animal health industry, for the animal health community, and overall for all Americans here. And it is a pleasure, actually, to be partnering on this. So now that this legislation has been introduced, what happens next?
So as you mentioned before, we have the bipartisan leadership of Representatives Claudia Tenney and Deborah Ross. I always say pets aren't even bipartisan, they're nonpartisan. Everybody loves pets. So political party doesn't matter here. This is something we can all agree on in our society, and pets make everyone's lives better. And so that's why it's a pretty easy ask to see if maybe other members of Congress might like to join in as co-sponsors for the bill. Usually so hopefully if there's a member of Congress or their staff watching, please consider signing up. And if you're a pet owner out there listening to this conversation, maybe contact your member of Congress and see if they might join in on this bill. With more co-sponsors, then we can ultimately get it passed, and that's when we'll be able to have the benefits of using our HSAs and FSAs to care for our wonderful pets.
So thank you, Steve, and thank you again for the opportunity to have this conversation with you today here in Capitol Hill during the Pet Week. It's wonderful to be working together with HABRI, and it's also very important that we support critical policy like the PAW Act. So thank you so much, and looking forward to seeing the bill passed.
Esther, so grateful for your time and for all the wonderful things that Zoetis does, including your critical support for the Human Animal Bond Research Institute. I really enjoyed our conversation. We should do this again sometime. Thank you.
Thank you.
Let me also thank Zoetis for sponsoring today's session and all of the Pet Week sponsors who've made a great week of programming possible. Since we've come to the end of our programming, it's really important to know that if you've missed any of the sessions that we've aired, you can see them again on demand at petnight.com or on the HABRI Facebook page. We're so grateful that you've joined us to learn about all the different ways that pets are good for human health and well-being. On behalf of the Human Animal Bond Research Institute and all of our partners, thank you so much for joining us. We'll see you next time.